Thursday also to do some of this review of the bones. We'll have joint stuff on Thursday as well. But let me see how far I can get with this. So first we'll start with the axial skeleton. All right. So the axial skeleton, I'm going to use the colored one just because it's easier to see some of these bones. Note that when you do it, I could give you one that's not colored, so you should know the areas as well anyway. All right, so let me go through these guys. Back up a little bit.
He's missing a face.
Yes, this is totally missing a face, but it's the only one I could find that had the nice colored thing. All right, so what's this bone here?
Frontal.
Yeah, that's your frontal bone. Okay. What would be inside of here?
Frontal sinuses?
Yeah, that's your frontal sinuses. Don't say the brain. I didn't mean the brain. But inside of here would be the frontal sinus. Okay. All right. Now, you have this connection. What's this joint called?
Coronal suture.
Yeah, that's the coronal suture. Okay. And then what are these green bones shown here?
Parietal.
Those are the parietal bones. Okay. And you have a suture between the two parietal bones. What's that called?
Sagittal suture.
That's the sagittal suture, right? It makes sense. This is in the coronal plane. That's in the sagittal. Actually, I guess you could call it the mid-sagittal suture if you really wanted to. All right. Then on the side here, what's this pink bone?
Temporal.
Yeah, that's the temporal. What's this line called?
Squamous suture.
Yeah, that's the squamous suture. Okay. And if you go on the back, what's this bone?
Occipital.
Occipital. And then what's this suture?
Lambdoid.
Yeah, see how it sort of kind of looks like a lambda? All right. Or an upside down V, whatever you want to call it. All right. So those all classify as cranial bones. What's this little guy shown from the side here? That's a cranial bone. What is it? No, it's not a facial bone. It's a cranial bone.
Sphenoid.
Yeah, it's the sphenoid shown from the side there. Okay. You look at it underneath. Right. See how it fits. Yeah, it touches all the bones. So they did they removed. What bone would be right here? Yeah, that would be the ethmoid. They unfortunately fell off in this model. But here's the sphenoid. It'd be touching the ethmoid. It'd be touching the frontal bone. On the sides, it touches a little bit of the parietal. It touches the temporal, and then in back, it touches the occipital. So that's why. What's the name? What's the name for the sphenoid? It's the what of the
keystone.
The keystone of the cranial bones. Okay. All right. Let's see some other parts here to talk about before I move sort of on the inside. Let me just mention what bone did you say this was?
Temporal.
Yeah, that's the temporal bone. Okay. This here, this is the zygomatic process of the temporal bone. Okay. Now, let me show you a real skull for a second, or at least one that's way. Okay. This here to about the midway part. Okay. There's a little suture that connects the two. To the midway part, this would be the zygomatic process of the temporal bone. You then go over the zygomatic bone, just to make things confusing. This is the zygomatic bone. It goes backward and meets up, and you have the temporal process of the zygomatic bone. So you have the zygomatic process of the temporal bone coming forward, meeting up with the temporal process of the zygomatic bone. Together, the two processes together form the zygomatic arch, which is that little thing there. All right. Let me go back to my colored thing. So this is the temporal bone that you mentioned before. All right. What's this part here called? It's a something process.
Mastoid.
That's the mastoid process. Okay. Inside there's a sinus as well, mastoid sinus. Okay. What's this hole here?
Acoustic meatus. Auditory acoustic.
There's one word you're missing.
External.
External acoustic meatus or external auditory meatus. Any of those would be fine. All right. What about? I don't know if you can see it. Let me go a little closer. See this real sharp pointy thing there? What's that?
Styloid.
Yeah, this is the styloid process. There's actually a little muscle there that goes down and the hyoid bone hangs off of the styloid process. On some of the real skulls, this is very fragile, so some of the real skulls, this got broken off. Okay. Anyway, so it's good to see it on the plastic skull. If I lift, what's this thing flapping here? What's this bone?
Mandible.
Yeah, that's the mandible. If I pull the mandible out, and you look at this sort of indentation here, what's this called?
Mandibular fossa?
Yeah, that's the mandibular fossa. Okay, so the mandibular process from the mandible, which is this guy here that I'm trying to stick in there, fits right inside that mandibular fossa, and that's what forms your temporomandibular joint, your TMJ. Okay. All right, let me go inside on some of this stuff here. Let's see what else I can show you. Oh, actually, wait a second. Something else I want to show you on the underside. Okay. What's this? Whoops. What's this hole? Yeah, the foramen magnum. Okay. See these little rounded things here and here. Okay. There's little rounded. Looks like, I don't know, like the legs on a rocking chair. What are those things?
Occipital condyles.
Yeah, those are the occipital condyles. You remember what those things are going to touch? What do they touch?
Atlas.
Yeah, they touch the atlas. They touch C1, and it's literally the rocking back and forth, right? It's the rocking back and forth on C1 that does the yes move, right? Someplace up. This one yes move thing? Yeah. Right? So occipital bone and C1 give you the yes move. It's known as the atlanto-occipital joint. All right. Some things to show you on the inside, since I can't really pry this thing open. Here's the inside. I need to back it up a little bit. Is my lighter on? There it is. Okay. What's this bone up here? Yeah, that's your ethmoid bone. Okay. If I go in a little bit closer, lots of people drop points over. Hold on. I know it's out of focus. What's this little upward projection of the ethmoid? That's the cristagalli, and actually it attaches to. You guys remember what's the name of the dura mater that separates the right and the left cerebral hemispheres? Anyone remember?
Falx cerebri.
Yeah, the falx cerebri. Remember that thing that runs right down the middle? Actually, the anterior part of that attaches to the cristagalli. All right, so it's an attachment point for that. All right. Now, this other part of the ethmoid is called what? What's that other part called? That's the cribriform plate, and what are the little tiny holes inside of it called?
Olfactory foramina.
Yeah, the olfactory foramina, and what runs through there again? Yeah, the axons of the olfactory sensory neurons. Good. All right. Now, if I back up a little bit, okay, it's hard to see because it's not colored, but what's this bone here?
Sphenoid.
Yeah, that's the sphenoid. Okay. If I wanted to back it up for a second here. If you really want to highlight it, picture this guy basically sitting inside of you. See how it would sit inside there? Okay. So that's your sphenoid. Okay. This part up here is known as what?
Lesser wing.
Yeah, those are the lesser wings. The part down here are the greater wings. Okay. A special thing that you should notice, you can kind of see it on the side. What's this little space in here called? Yeah, that's the selatursicon. I told some of you guys, what does it mean? Turkish saddle. If you do a Google search for like Turkish saddle, that's kind of what the saddle on it.
What's it called again?
It's the selatursicon, which is like Latin or Greek or something for Turkish saddle. Okay. If you look up like Turkish saddle, I guess in Turkey, that's what their saddles look like. There's my horse, and that's the saddle on my horse. And what's the little guy that sits inside the Turkish saddle? Yeah, it's the pituitary gland. Okay? It literally sits right inside of there. If you have a tumor on your pituitary, one of the things that they do to get to the tumor is they use a transsphenoidal approach. They actually go through your nasal cavity. They cut a hole through the sphenoid bone and sort of get to the pituitary from underneath. Okay? Yeah, I know, it sounds kind of crazy, but that's what they do. All right, other thing I want to show you on here too, you saw these guys, what was this hole again called? External acoustic meatus or external auditory meatus, either one's fine. On the inside, there's lots of funky holes and things, but this guy right here, what do you suppose that hole is? Internal acoustic meatus, okay? So this guy here is the way that the vestibular cochlear nerve basically gets into the brain and connects up, right? All right. I think that's all I wanted to say about that. All right. let's talk about the facial bones very quickly. Actually, wait a second. Maybe I'll switch to. Yeah, let's switch to this one. All right. Now let me back off. Okay. What's this bone here? Yeah, that's the maxilla. It's actually two bones. You can see where you got a left maxilla and a right maxilla. Okay, they fuse in the center. Okay. What are these two little bones that are sitting up here?
Nasal bones.
Yeah, those are your nasal bones. Okay. If you go medially inside the eye socket, what's this little bone here?
Lacrimal bone.
Yeah, and see there's the lacrimal groove, or for the nasal lacrimal duct. Okay. It's just a little spot that allows the duct to go through and get into the nasal cavity. Okay. What's this bone here?
Zygomatic.
Yeah, that's your zygomatic bone. And here's what I was talking about. This part classifies as the temporal process of the zygomatic bone. This classifies as the zygomatic process of the temporal bone. So the two of them together make the zygomatic arch. Yep. Okay, what else can I show you on here? On the under surface of the maxilla. Yeah, well, okay, so this is what does this whole area here constitute? What's that called in layman's terms? Your hard palate, okay? The anterior part of the hard palate is formed by the maxilla, okay? It's called the palatine process of the maxilla, so it's part of the maxilla. The posterior part back here is formed by the palatine bones themselves, and that's known as the horizontal plate of the palatine bones. Okay, I think they had it, yeah. Yep. So, horizontal plate of palatine bones, palatine process of maxilla, that makes your hard palate. If you keep pushing your finger back, eventually you'll get into soft tissue, and that becomes your soft palate. Okay. Other stuff to show you on here. Oh, the incisive foramen is this hole right here. Okay? There's a hole right behind your incisors for blood vessels and nerves to go through it. So that's that hole right there. That is a screw. That you don't have. Right? That's the...
Well, that's good to know.
Yeah, come up with it. All right. All right, that's all I pretty much wanted to say about that. Let me get... Where's my mandible roaming around here? I had one. Okay. I wonder if this mandible is close to fitting this skull. Sort of. All right. This is the mandible, okay? This is considered the body. Okay, this is these guys together that goes up at an angle. This whole thing's considered the ramus. Okay. This part that goes up and it forms the joint, the one that forms the TMJ joint. Okay, that's the mandibular process, or sometimes called the condylar process. This part here, the pointy part, is the coronoid process. Okay. That's an attachment point for muscles of mastication. Okay. This is called the mandibular notch, the spot between it. Okay. There's some holes on the front here. These holes are called what? Anyone know? Yeah, those are the mental foramen. I can't remember. Back to week 1, did you learn? I don't think I taught you guys this, but your chin region, the fancy name for the chin region is the mental region. All right. So these are the mental foramen. Again, blood vessels, nerves go through those holes. Okay. If you flip around the inside of the jaw, there's a mandibular foramen that sits on the inside. So right there and right over there. More blood vessels, more nerves. Apparently, like when the dentist is doing like a procedure on like your molars, one of the places they put the needle in is around in there to kind of try to numb up the nerves as they come out of the mandibular foramen. Okay. The actual name for the sockets that the teeth fit in are called what? Anyone know? The sockets are called alveolar processes. Okay, fancy word for the teeth sockets. So you have alveolar processes on your mandible. So these are your mandibular teeth, but then you also have alveolar processes on your maxilla for your upper teeth, for your maxillary teeth. All right, I think that's pretty much what I want to say about this guy. Let me go further down. The next thing, if you're going, hold on. let me do the fontanelles real quickly before I get too far away from that. The fontanelles, where's my baby skull? All right. Here's baby skull. Okay. What fontanelle is this? Frontal or anterior fontanelle. That's the biggest one. That's the latest one to close. Oh, this got smashed in back. But what would this little fontanelle be?
Posterior.
Yeah, that's the posterior or the occipital fontanelle. Either name's fine. Then on the sides, you have some fontanelles. Again, these are pretty much closed, but what would this fontanelle here be? That'd be the anterolateral or the sphenoid fontanelle. And then back here is the posterolateral or the mastoid fontanelle. Okay? This guy fuses first, about 3 months, 6 months, maybe 9 months to like, I don't know, 13 or 14 months, and then this is like, I don't know, maybe 10 months to about a year and a half. Okay. All right, let me move on. That was my fontanelle guy. Keep going down. I'm not going to bring out the auditory ossicles. Hopefully you still remember the stuff you learned from the ear bones. Okay. Hyoid bone. The only place you can really see the hyoid bone is on this whole body model, and it's this guy hanging here. Okay. Again, what's the claim to fame for the hyoid bone? It's the only bone that...
It doesn't make a joint.
Right, it doesn't make a joint with another bone. All right, it's just hanging there, actually hanging off of the styloid process of the temporal bone. All right. The big part in the middle is called the body. The little pointy guys that go up are called the lesser horns. The guys in back that go up are called the greater horns. So that's the hyoid bone. It's an important attachment point to muscles that help you swallow and help move your tongue around. Okay, vertebrae. Lots of different vertebrae. Let me show you the stereotypical vertebrae first, and then I can get into some of the other ones. Okay. Here's a vertebrae. Okay. This happens to be, anyone know where it's from? Lumbar. Look at the moose. All right. Yeah. Miguel and the guys at this table, Lauren and Carolina, told me that these look like animals. So this looks like a moose. Everyone see the moose? All right. Well, go out, take some substances in the hallway, come back in. I guarantee it'll look like a moose.
That's right.
But you know, they all come to class affected. Yeah, we know. Anyway, let me go through the general parts of any vertebrae. Unless you're dealing with C1 and C2, which are kind of funky, most vertebrae have a couple parts to them. What's this big part called?
Body.
That's the body, the vertebral body. Okay. You have then this part that forms an arch. That's called the vertebral arch. Okay. Let me go a little bit closer. So all of this, all the way around, is the arch. So you've got body, and then you've got arch. And what's the hole in the middle called?
Vertebral foramen.
Yeah, that's the vertebral foramen. What's running through that?
Spinal cord.
Spinal cord. Okay. Now, the vertebral arch actually has different parts to it. Okay. The little part that connects up, this little short part that connects up with the vertebral body, is called the pedicle, or the pedicel. Okay. So pedicel, and then the part that connects from the pedicel to what's called the spinous process, this flat part that goes right here, is called the lamina. All right, so the vertebral arch consists of 2 pedicels and 2 lamina. So pedicel, lamina, lamina, and then pedicel again. That makes the vertebral arch. Now, coming off of the vertebral arch are lots of processes. Again, these things are small bones, but there's a lot going on with the vertebrae that make them kind of tricky. All right? Coming off the vertebral arch are a number of processes. The big one that goes to the back, this one, is called the what?
Spinous.
That's the spinous process. Okay? The ones that go off to the sides are called the what? Those are the transverse processes. And then you have 4 more processes. 2 of them go up. So these 2 are going upward. Those are the what?
Superior articular.
Those are the superior articular processes. And then you have 2 going downward. Those are the inferior articular processes. Okay. The spinous processes are an important spot where a number of muscles attach. Muscles also attach to the transverse processes and allow you to do kind of lateral bends to your back. Okay. The transverse processes in the thoracic region are also important because that's a spot where the ribs touch. The superior and the inferior articular processes are important because they're what form the joints between the vertebrae. So this vertebrae forms a joint above and below it using its superior and its inferior articular processes. So let me see if I can find a vertebrae that matches up so I can show you what I'm talking about. Wow, first try, I can't believe it. All right, so let me back it up just a little bit. So they'd be fitting together like this, okay? What would be between the two bodies?
Intervertebral
Yeah, there'd be
disc.
an intervertebral disc there, okay? If you look on the posterior surface, you can see how I mean, this isn't a perfect fit because I didn't pick two levels that were right next to each other, but see how the inferior processes of this vertebrae are touching with the superior processes of the one below it, okay? On the surfaces of the superior processes and on the inferior processes are flattened areas that you learned about. Those are what are called the facets. So you have the facets of the inferior processes literally rubbing against the facets of the superior processes of the vertebrae below it. And that's what forms the joints between the vertebrae. All right? On a sideways view, there's something else you can see. I told you that this hole down the middle, what's that hole down the middle called?
Vertebral foramen.
Yeah, that's the vertebral foramen, or the vertebral foramen. On the sideways view, when you have two vertebrae together, you kind of create another foramen. What's this foramen there?
Intervertebral.
Yeah, that's the intervertebral foramen. That's the foramen, inter means between, so that's the foramen between the vertebrae. What do you suppose comes out of the intervertebral foramen?
Spinal
Nerves.
The spinal nerves, right? Okay. So that's kind of your overview of what a stereotypical vertebrae looks like. Now let me go into some of the finer points now. The vertebrae can be pretty tricky. Oh, I'm on the wrong page. Okay, you're right. All right, so cervical vertebrae. What did I give myself here? Did I give myself anything? I know I was going to knock something over sooner or later. Come on, where are you at? Here. All right. It's not. All right, let me see if I can find. Anyone have C1 and C2? Did anyone swipe those? Let's see if I can find them. Oh, there's C1. Oh, there it is. Nice. Okay. Okay, that looks pretty